Welcome in, everybody. My name is Dr. Raymond Tolmos. Even my mom calls me Dr. Ray, though, so you guys are welcome to call me by that. It's a persona that's kind of grown over the years. Today's talk is going to be about functional medicine, Western medicine, holistic treatment. How do we combine all of these worlds together? Because there's a lot of benefits when it comes to Western medicine. There's a lot of benefits when it comes to holistic treatment. And so oftentimes we find these on two different sides of a gap, right? So how do we bridge that gap? Well, through my training as a chiropractic internist, and that doesn't mean that I'm an intern in a chiropractic practice. What that means is that I'm a chiropractor that actually has training in managing internal disorders. But instead of treating and trying to manage disease and dysfunction with medication, what we actually strive to do is help patients understand why they've developed these generally chronic lifestyle diseases. In America, we're not dying so much from infection anymore. We're not dying from the things that we used to before Western medicine really into all these things. Nowadays, what we're dying from is heart disease, cancer, diabetes, chronic lifestyle conditions. So we're treated by the medical system saying, here, take this, and this will control your blood sugar. But we're not paying attention to why that blood sugar is in disarray in the first place. So what I do when I analyze my patients is the same thing their medical doctor would. Have them come in, take their history, sit down, we'll talk, figure out what this person is struggling with in their day-to-day life. Then we'll do a physical exam. And this is actually a lost art form nowadays. Most times when you go to the doctor, they spend 6-10 minutes with you, never put a hand on you, ask you a couple questions. Half the time their back is turned and they're typing things into a computer. I spend as much time as possible looking at the hair, the eyes, underneath the eyes, the fingernails, the skin, listening to the heart, listening to the lungs, listening to the abdomen, feeling what's going on in the abdomen, checking out all the lymph nodes in the body, because each one of these things tells us about how the body is functioning. And at the end of the day, disease doesn't just happen. It develops from dysfunction over time. So what we try to do is figure out, well, where is this dysfunction? Because there's a huge gray area between being completely healthy and developing a disease. And there's absolutely nothing that medicine can do for that gray area. And this is where most of the people in the United States actually reside. Life expectancy has definitely gone up, but where has quality of life gone, right? Most people over the age of 40 are taking at least one medication, right? So why has that person's body lost the ability to do what this medication now has to do? It's because we're not thinking right. It's because we're not eating right, and it's because we're not moving right. So my job is help people understand the choices that they're making on a day-to-day basis and how that's translating into what their blood chemistry shows us, what their hormone analysis looks like. So by getting all of this data and then understanding what this person does on a day-to-day basis, we can then prescribe, instead of take the two of these and call me in the morning, this is how you exercise. This is what you need to eat. This is what you need to avoid eating. These supplements may help you. These herbs may help balance your immune system. And this is how you need to manage stress. Now, I personally am not a licensed mental health counselor. I don't claim to be. My job, and what I'm trying to help people realize, is that primary care should be the doctor that helps you feel good, stay healthy, prevent disease. There is no such thing as prevention in the United States. There's early detection, but that doesn't prevent anything from happening. That only tells you once something has developed. And then everybody wants insurance to pay for every single problem that's happened. Or, and I can't sleep, insurance should pay for it. Or now I got this cut, it won't heal, insurance should pay for it. Yes, true. But insurance nowadays says, number one, they don't pay to improve or maintain your quality of life. So unless something has already gone wrong, insurance is not going to help you, unfortunately. So what I try to help people realize is that you need to research. You need to be your own advocate. Just this year alone, unfortunately, I've had to diagnose 3 people with cancer who came from their medical doctors. I had these symptoms, they can't figure it out, nobody knows what's going on. Through physical examination, I was able to detect tumors. Their doctor never touched them. So, again, the physical exam, the emotional evaluation, these are all things that need to be considered. And at the end of the day, these are all things that need to be balanced. A lot of people say, oh, you know what, you should go to a functional medical doctor. But there's a difference in philosophy. At the end of the day, I'm a chiropractor. That's my initial training. Chiropractors believe that the body heals the body. As long as you're balanced chemically, emotionally, you can heal. There is not a disease that has not been healed from. So what we try to help people do is find out where these imbalances are and show it to them in black and white. There's a lot of holistic doctors. There's a lot of alternative medicine providers that practice in a way that does help patients improve. But it doesn't communicate with patients the way that medical doctors do, and it doesn't bridge that gap. That's why we have two different sides. We go about it completely differently. Applied kinesiology does not match with blood work, right? So if we can diagnose the same way, then we can help patients make the right choices, and everything is still science-based the way every medical doctor wants to see it. So at the end of the day, in my community, I work with gastroenterologists, rheumatologists, endocrinologists, all the different specialists, and oncologists especially. A lot of patients with cancer come in because they want to not just take chemo and feel bad. They want to feel good. They want quality of life. So we provide them with IV nutrition. We provide them with glutathione. We provide them with the infrared sauna. We provide them with every single natural therapy that we can in order to help them improve their quality of life based on the test results that we're seeing and what they're telling us and what their physical exam is showing us. So if we can take that world of Western conventional diagnosis and we can then help people understand what that's turning into, how that's translating into how they feel, we can take care of all those people in that gray area that the doctor just says, you know what, everything looks good, or it's all in your head, or, we can't figure it out, or we don't know about that, right? There's multiple conditions nowadays that medical doctors are starting to kind of open their eye to because so many people are coming to them with these issues like SIBO, for example, small intestinal bacterial overgrowth. Most gastroenterologists will just say, oh, no, that's, something made up. It's not really a Western medical thing that we deal with because at the end of the day, it's a dysfunction. It's not a disease. It's an overgrowth of bacteria. It acts like a parasite, right? So, and there isn't a test that's been done for 17 years straight that says, hey, this is SIBO, right? So it takes a long time for the research and for things to get done in the medical world. And we're learning new things every single day. Comprehensive stool analysis is one of the best tools that we have in order to help people understand how their body's getting what it needs. At the end of the day, who remembers that old saying, you are what you eat, right? I'll take it a step further. You are what you absorb. You could be eating the most perfect diet in the world, but if your gastrointestinal system is not healthy, you might not be getting everything you need from your food, right? So I'll take it a little step further as well. We talk about supplementation. Other people want to do everything with food, but sometimes we have to be realists. The nutrition that we have in an apple today is not what it was 20 years ago, 25 years ago. Why? Because we're over farming. The soil doesn't have the same quality. There's all types of chemicals and all types of other things. We're exposed to so many other toxins, right? There's waves coming from everywhere, right? We have power, we have Wi-Fi. Every room you go into, there's a wave hitting you from somewhere else. When's the last time your feet touched the ground without a shoe or concrete in between? Our balances are all off, physically, chemically, emotionally. We're go, go, go. We never take the time for self-love, for self-care. And because of that, those emotions, that stress, there's physical manifestations to it. And so we never know what's the chicken. We never know what's the egg, because especially with the gut and the brain connection, right? There's such a heavy influence on each one of those. If you're anxious, ooh, I got butterflies, right? But if your stomach's hurting, you're probably anxious as well. So which one is, which one's the guy that we need to go after? And that's where the difficult part is. So taking that history, understanding what's been going on since childhood, were you breastfed, were you born naturally? These things play such a large role in your immune system, which at the end of the day is the absolute most important thing in your body. Think about your nutrition like your paycheck, right? You have to budget rent, you have to budget cable, you have to budget groceries, you have to budget a whole bunch of stuff into that paycheck. Your body does the same thing. You need to produce cells. You need to produce energy. You need to produce antioxidants. You need to produce chemicals, right? All hormones. You need to produce all these things. So what we try to do again is make sure that people understand the choices that they make. The salad or the burger. If you pick the burger more often, you're going to have more problems than if you pick the salad, right? But maybe you can't digest that salad. So maybe you need to do something first to help you be able to actually digest the food that you're taking in that's good for you. If you go to a specialist, they're evaluating one system. When you see someone that thinks about your body holistically, it's taking all those systems, wrapping them up into one big picture, and understanding how that picture is functioning. So remember that disease comes from dysfunction, and dysfunction comes from the choices that we make on a day-to-day basis. We even take it down to the cellular level in my practice, where we look at the upcoming field of epigenetics. A lot of people have heard about this. Since the genome has been decoded a few years back, there's been tons of studies about how specific little codes in your DNA, which is the instruction manual for your body, are affected by the environment. So if we can learn how to turn some of these on and turn some of these off, and we can learn how your body is functioning, we can create a personalized, individualized plan to help each person be as healthy as they can possibly be. Quality of life, that's what we're looking for. Prevention of disease, that's what we're looking for. But you can't find that in only the Western medical world. So by combining Western medicine and holistic treatment, we've been able to create the best of both worlds. And I'm looking forward to tell as many people about this, because the gratitude that I get from the people that come in is just amazing. They've seen 4 or 5 doctors. I tell people, look, this should be your first stop, but it's often the last hope. So with that being said, be your advocates, do your research, understand that conditions and diagnoses are one thing, but they don't come from that Latin word. They come from the choices that we make in most cases. So with that being said, everybody have a great day, and thank you for your time.